Welcome, everyone, and thank you for joining today's webinar on communicable diseases in daycare settings. My name is Samaya. I'm the lead disease surveillance practitioner, and I'll be leading the presentation today. Here's a quick overview of what we'll be covering. We'll start with measles, then review other vaccine-preventable diseases. We'll go over common respiratory and gastrointestinal illnesses, as well as skin conditions like hand, foot, and mouth disease and fifth disease. Finally, we'll wrap up with infection prevention practices and reporting requirements. So we'll begin with measles. The most common symptoms of measles are fever, rash, and the 3 C's, which are cough, coryza or runny nose, and conjunctivitis. It is transmitted through direct contact with respiratory droplets or through the air. From when someone is exposed until they develop symptoms, it takes about 7 to 21 days. An individual is considered infectious 4 days before the rash appears to 4 days after the rash appears, counting the day the rash appears as day 0. And this is why we isolate individuals through the 4th day of the rash. Anyone who is susceptible or not immune should be quarantined from days 7 to 21 after they were exposed. For vaccination, MMR should be given at 12 to 15 months and 4 to 6 years. The 2 doses are 97% effective at preventing measles. We are seeing measles cases in the U.S. rising, especially in this current season, which makes preparedness important. In daycare settings where we have a higher risk population and close contact, the potential for rapid spread is much greater. Make sure you know exactly how to contact us at the Kane County Health Department and that your staff are familiar with the guidance, regulations, and internal policies. You should be educating both staff and families about symptoms and what to do if a case is suspected. Education efforts should also include information on vaccination along with providing resources. Have a clear procedure for suspected cases. Monitor for early symptoms like the fever and rash. Maintain up-to-date immunization records for the children and staff. This includes reviewing your records now and following up for those without proof of vaccination. If there is an exposure, anyone who doesn't have records available has to be treated as susceptible. Have a designated isolation space ready to use immediately. And finally, make sure you have supplies like masks easily accessible so there's no delay in response. The first 10 minutes of a suspected measles case are extremely important. You want to immediately mask the individual if they're over 2 years old and isolate them in a designated area. Limit exposure by minimizing staff movement in and out of that space. If it's a child, notify the parent caregiver right away for pickup. If it's staff, they should be sent home or remain isolated until they can leave safely. Use proper personal protective equipment or PPE, ideally with immune staff. No susceptible contacts should have contact with the case. And contact the health department right away. Measles must be reported within 3 hours. You'll also want to advise medical evaluation and monitor for severe symptoms like difficulty breathing. After the person leaves, keep the room vacant for 2 hours to allow airborne particles to settle, then clean and disinfect thoroughly. This slide just highlights the CDC's checklist for early care and education centers in regards to measles preparedness. The information we just reviewed on the 2 previous slides is directly taken from this checklist, which you can use as a reference in your facility. Next, we'll go over other main vaccine-preventable diseases. Now, mumps is not very common, but every once in a while, we will get a call about it. Symptoms of mumps include unilateral or bilateral parotitis, which is basically swelling of the saliva-producing glands, muscle aches, malaise, headache, fever, and loss of appetite. It is spread through direct contact with respiratory droplets. From when someone is exposed until they develop symptoms, it is on average about 16 to 18 days, with 25 days being the maximum. An individual is considered infectious 2 days before and 5 days after the parotitis onset. They should be isolated through day 6. Anyone who is susceptible or not immune should quarantine from day 12 from exposure through day 25. And same as measles, a child should get vaccinated at 12 to 15 months and 4 to 6 years. Common symptoms of varicella, or otherwise known as chickenpox, include rash, fever, and malaise. Chickenpox is spread through direct contact with lesions or lesion fluid and airborne transmission of lesion fluid aerosols. From when someone is exposed until they develop symptoms, it usually on average takes about 14 to 16 days, but the max is 21 days. A child is considered infectious 1 to 2 days before the rash presents until all lesions have dried. It's important to isolate sick individuals through day 6 of the rash and until the rash is crusted and there have been no new lesions for 24 hours. Immunization recommendations are the same as measles and mumps. MMRV at 12 to 15 months and 4 to 6 years. Common symptoms of pertussis, otherwise known as whooping cough, are cough, including coughing fits, whooping sound, post-tussive vomiting, apnea, which is basically temporary pauses in breathing, cyanosis, which is a blue or grayish color of the skin caused by a lack of oxygen in the blood, and fever. It is transmitted through direct contact with respiratory droplets or airborne transmission of droplet nuclei. On average, it takes about 5 to 10 days for symptoms to develop after being exposed and max 21 days. A child is considered infectious from onset of symptoms through 21 days or until completing 5 days of antibiotics. This is why we isolate sick children through the 5th day of antibiotics or for 21 days after cough onset if they didn't receive any treatment. If any contacts develop symptoms, they should be excluded until they are tested and/or treated. For immunization, a child should receive the DTaP shot at 2, 4, and 6 months, at 15 to 18 months, and then at 4 to 6 years. So they should have a total of 5 doses at school entry. A common question is whether everyone needs antibiotics if there has been a pertussis case, and the answer is no. Antibiotics are usually recommended only for close contacts, regardless of how old they are and if they've been vaccinated. These close contacts would include household members, individuals sharing a confined space for over an hour, and those with direct exposure to respiratory secretions. So the last 3 diseases we covered, mumps, chickenpox, and pertussis, are all reportable within 24 hours. This applies to suspect and confirmed cases. Respiratory illnesses are very common in daycare settings as well. The most typical viruses we see are influenza, RSV, and COVID-19. Symptoms include fever, cough, runny nose congestion, sore throat, muscle aches, shortness of breath, or difficulty breathing. An individual who has had a respiratory illness may return to daycare when they have been 24 hours fever-free without using medications and overall have symptom improvement. Once they return for the next 5 days, hygiene practices and social distancing should be enhanced. They should also wear a mask if over 2 years old. One important thing to keep in mind with respiratory illnesses is that individuals can still be contagious even before or after symptoms improve, which is why those extra precautions are important. While exact timing varies, flu, RSV, and COVID-19 can all be spread before symptoms begin and continue for several days after, with RSV sometimes lasting even longer. For children, flu vaccination is recommended broadly for ages 6 months and up. RSV prevention focuses mainly on infants whose mothers didn't receive the RSV vaccine while pregnant and certain high-risk young children, while COVID-19 vaccination is recommended for younger children and those with risk factors or weakened immune systems. If you notice an uptick in respiratory illness at your facility, there are a few key steps to take. Monitor how many cases you have among children and staff. Communicate with the parents and staff when there's an increase. Post guidance to reinforce prevention. Educate staff about typical symptoms and those that require emergency care. And remember that individual cases of respiratory illness are not reportable, but clusters outbreaks are. Gastrointestinal illnesses like norovirus are very common in daycare settings and spread very easily. Symptoms include vomiting, diarrhea, stomach pain, cramps, fever, chills, headache, and muscle aches. Symptoms usually last 12 to 72 hours. An individual can return to daycare when diarrhea, vomiting, and fever have ceased for 24 hours. Siblings of cases are not required to stay home if they are not having any symptoms. Just like the respiratory illnesses, individual cases are not reportable, but clusters outbreaks are. Hand, foot, and mouth disease. We for sure see a lot of this in daycares. The most common viruses that cause this disease are Coxsackie virus and enterovirus. Symptoms include rash in mouth, hands, and feet, hence the name, fever, loss of appetite, sore throat, and malaise. Some people may not have any symptoms at all. One can return to daycare when they have been without a fever for 24 hours not using medication, can maintain hygiene, so kids not drooling everywhere, and avoid contact with others, and they feel well enough to engage in normal activities. Again, individual cases aren't reportable, but clusters or outbreaks should be reported. I want to note that it's important to report clusters to us in order to receive guidance on mitigation efforts and reduce the risk for an outbreak. Last but not least, I just want to quickly go over fifth disease. This is a disease caused by the parvovirus B19. It is a common mild rash illness. Symptoms include redness of the cheeks and body, slapped cheek rash, mild fever, runny nose, and headache. Rash may come and go for weeks. An individual can return once they no longer have a fever or any other symptoms that would exclude them. Like the others, only clusters or outbreaks need to be reported. These are your everyday prevention strategies, and they really do make the biggest difference. Hand hygiene, especially after coughing, using the restroom, and before eating. Cleaning and disinfection, paying attention to those high-touch surfaces, shared items, diapering areas, potty chairs, toilets, sinks, food prep areas, and being aware of the proper contact time, so allowing the surface to remain visibly wet for however long is indicated in order to kill the virus or bacteria. Respiratory etiquette, covering coughs, sneezes, wearing masks when appropriate. Appropriate personal protective equipment or PPE, wearing gloves, masks, etc. based on exposure. Ventilation, opening the windows, improving airflow when possible. Avoiding close contact when you are sick. Vaccination, staying up to date with your immunizations as applicable. Testing symptomatic individuals. This is recommended and encouraged, especially during clusters or outbreaks. It allows pathogens to be identified and ensures proper treatment or exclusion. Avoid sharing personal items like linens, toys, utensils. Proper disposal of soiled tissues and contaminated materials. In addition to general prevention, some illnesses require more targeted measures. For skin conditions like hand, foot, and mouth disease, fifth disease, and chickenpox, keep lesions covered, avoid scratching in direct contact with the lesions, and it is recommended for nails to be kept short and trimmed when these lesions are present. For GI illnesses like norovirus, staff should wear masks when cleaning vomit, stool spills due to possible aerosolization. Use proper disinfectants such as an EPA-registered product effective against norovirus or bleach solution. Strict hand washing. Hand sanitizer is not preferred in this case, and separate food preparation and diapering duties. The Communicable Disease School Nurse Guidance from the Illinois Department of Public Health is a really helpful resource. It gives quick, easy to find information on the diseases you're most likely to see in a daycare setting. It's not realistic to memorize things like infectious periods for every illness, so this is something you should always refer back to. Our Communicable Disease Reporting and Resource Manual for schools and child care centers is currently in the process of being published. We hope to have this updated resource available for you soon, and it will be posted on our website. Here is our reportable disease poster. This is a really useful quick reference tool that outlines which diseases are reportable in the required timeframes for reporting. We recommend keeping this posted or easily accessible so staff know when and how to report. You can also access it anytime using the link on this slide. If you want to report a cluster outbreak, you would just simply go to our website at kanehealth.com, click on infectious disease information, and then click on where it says report an outbreak. It will take you to a form, complete the entire form, and submit. Once you submit, someone from our team will follow up with you. You can also go to school and daycare health resources, and under the communicable disease section on that page, there is a link at the top as well to report an outbreak. I just want to remind you to make use of the school and daycare health resources page on our website as it contains a lot of useful information. This is also where that new school manual will be posted once it's published. If you have any questions or you need to contact us, you can just call the number listed here. After you press 4, you will be directed to the main line for communicable disease. If no one answers, please leave a voicemail and someone will get back to you as soon as possible. Our business hours are from 8:30 a.m. to 4:30 p.m. We have an after hours option available as well, but that is only for emergencies. These slides provide a variety of resources from us, Illinois Department of Public Health, and the Centers for Disease Control. So be sure to check them out once you receive the slides. Thank you.